Good morning, ladies and gentlemen, and welcome to this session, which we titled Not Lowering Our Guard for the Next Pandemic, a multi-sectoral One Health approach to preparedness. My name is Ole Høyer. I am Head of Disease Programs at ECDC, at the European Centre for Disease Prevention and Control. When we came out of the pandemic, I believe we all felt that we had received a reminder. You could even say a warning saying that even at this time where science is highly developed, pathogens from the animal or the environment can cause a human health crisis, a public health emergency. In order to be better prepared in the future to counter the next crisis, we need to learn to work together across the animal, human, and environmental sectors. That is what we normally call the One Health approach. The COVID-19 pandemic was also a reminder that we stand small against the nature and that we still need much collaboration, coordination to be able to withstand crises like we experienced in the pandemic. In this session, we will explore how the One Health approach can improve Europe's preparedness for future pandemics and public health emergencies. And together with a panel of experts, we will address how the intersectoral collaboration can improve to increase our ability to be prepared for the next crisis. I would like to invite first our director of ECDC, Pamela Randi Wagner, to give the opening address. Please, Pamela.
Well, good morning, everybody, and warm welcome to the ECDC session, which is kind of a historical tradition at the European Health Forum here in Gastein. And it's also a pleasure to see so many faces and colleagues being interested in this very important topic of One Health approach. Undoubtedly, the threats we are facing, and they are becoming more and more, these threats are becoming more and more complex. It's climate change, antimicrobial resistance, forever chemicals. These are only few to name. All of those pose a significant risk to public health, pose a significant risk to the health of 500 million people in Europe. And I think it was President von der Leyen saying, what affects climate and environment affects people. And I think this was a very, very important sentence. Beyond the health of our communities, they also threaten the resilience of health systems. The threats we face, as I said before, they are so broad, so the response and answer to these threats can only be broad. So we need a holistic approach in order to respond. Heat waves, floodings, the spread of diseases carried by mosquitoes further north in Europe are somehow linked to climate change. AMR threatens to undo a century of progress in medicine right now. Our food chain also poses its own risks. And what we can assume, and it has been said already by Ole, what we can assume is that the next pandemic comes from an animal reservoir. Again, this is not a secret. As we see, the avian influenza is already knocking at the European door, actually in the US much more. But just look to Finland, who have already have their experiences with H5N1. And I'm very happy that we have also a Finnish panelist who will go into more detail and tell us about the Finnish experiences. So the big question coming up again and again during the European Health Forum during the last years, but also this year, is, are we prepared for the next pandemic? And if yes, how do we prepare best? Knowing that an animal reservoir is playing a decisive role. one of the important lessons learned, of course, is cooperation and more coordination. It needs more cooperation and coordination between the European member states, but also between international organizations. But it needs, above all, more coordination and cooperation between scientific silos. We need to make sure that there is a connection, there is an interaction between these silos to begin to work across sectors. Human, animal, environmental health all need to be at the heart of our joint activities. So coming back to preparedness, without joint preparedness planning across relevant sectors, we cannot even hope to be ready for the next pandemic. That is why I'm so pleased to see so many of you here today, and thanks also to our panelists. One Health is not new. It's not a new concept. We all hear this for a very long time, and I know that many of you have been working hard to change the silo mindsets of our colleagues and departments and organizations and start looking through a One Health lens. But mindset change is not enough, but it's an important first step. There are challenges and obstacles, huge challenges and obstacles when it comes to intersectorial cooperation, when it comes to real-life cooperation. However, we all know that different agencies, EU agencies, different scientific areas, they all face different legislations, different frameworks, different mandates, different responsibilities, different areas of focus. Yes, and different blind spots. So I think we could also define working together means to be able to fill each other's blind spots, drawing a big picture together. As a very first important step, ECDC has just published in May this year the joint One Health framework with the 4 other EU agencies involved. It's the European Chemicals Agency, Environmental Agency, Food Safety Authority, as well as the European Medicines Agency, EMA. This framework covers basically strategic research coordination, capacity building, stakeholder engagements all across Europe, and also other joint interagency activities. Our work with our partner agencies is vital. It's crucial to enhance and strengthen Europe's preparedness in the future. And having this importance in mind, I'm looking so much forward to this engaging and fruitful discussion with you here today. So thanks again for joining us. Thanks to the panelists, and also thanks to the ECDC team for organizing this very important session. Ole Hoyer, Catherine Edwards, and also Daniel Schotte. You did a great job to a very, very important topic. So thanks to all of you, and let's get started with a new mindset and overcoming the obstacles. Thanks again, and now over to you again. Ole, thank you.
Thank you, Pamela. Not only at ECDC and with the ECDC director, there is a devotion and commitment to One Health. The 5 agencies that the director just mentioned, so ECDC, EFSA, ECHA, EMA, and EEA, have gone together in this cross-agency One Health task force. The 5 directors are also personally committed, and we have a video that we would like to show you, which brings a message from the 5 directors. So please.
Health challenges today are multifaceted. The approach that recognizes that human, animal, plant, and environmental health are all interconnected is called One Health. 5 EU agencies providing scientific advice on environment, public health, and food safety have published a joint framework for action to support the implementation of the One Health agenda in Europe.
Human pressures on the environment and the changing climate have significant impacts on our health. Despite progress, in some areas, environmental pollution still impacts our ecosystems and is linked to 1 in 10 premature deaths in the EU. Extreme weather events are becoming more frequent in Europe, causing loss of life and posing major challenges for food and water security.
We need to collaborate in a One Health approach across the sectors, at the EU and the global level, to protect human health also against the effects of climate change. Climate change may increase the risks of infections in animals and in return could significantly impact human health. Warmer temperatures could allow mosquitoes to carry infectious diseases like dengue or chikungunya to expand further into Europe. If we tackle this issue from both sides, the animal as well as the human side, we have a much greater chance of minimizing the risks. This is why a One Health approach is of utmost importance to be prepared in the best possible way and to protect people in Europe against new emerging diseases and also future pandemics.
Chemical pollution of air, water and soil arising from human activities can be harmful to our health, the health of our animals and of our environment. An illustrative example is the EU's restriction of microplastics. These tiny particles not only contaminate our waterways and soil, but also enter the food chain, affecting both wildlife and human health.
The health challenges we face today are not isolated. This is something we have learned from the pandemic. Human health, animal health, and the environment are all interconnected. We need to work together to prevent, detect, and respond to environmental and health crises. Tackling challenges such as antimicrobial resistance and disease outbreaks through better prediction and effective mitigation requires a One Health approach.
The human, environmental, and animal sectors cannot effectively combat health challenges like AMR or climate change on their own. That's why it is important to enhance cross-sectoral collaboration. At EFSA, we support the implementation of the One Health approach. This way, we will be providing health assessments going beyond regulatory silos. Because we need to recognize the link between the health of humans, animals, plants, and their shared environment. Ultimately, we will be better at preventing, detecting, and responding to health threats in Europe.
The joint framework for action by these 5 agencies will focus on 5 strategic objectives: strategic coordination, research coordination, capacity building, stakeholder engagement, and joint interagency activities. This will ensure that the scientific advice provided by these agencies is increasingly integrated, that the evidence base for One Health is strengthened, and that the agencies are able to contribute with a united voice to the One Health agenda in the EU.
Thank you. So in the session today, the session will have 3 parts. First, we will have a conversation with our panelists, which I will introduce to you in a moment. Then in the middle, there will be a part where you can ask questions, and we will also address the online audience through Vincent, one of the younger Steiners sitting over here. And we continue with the last session also with questions to the panelists. And then that's the program for approximately the next hour. I would then like to introduce our panelists. First, we have Tilly Metz, member of the European Parliament. And there is Tilly.
Hello.
And as you see, Tilly is online. And welcome, Tilly.
Thank you. Happy to be there.
Welcome. So I would like to introduce Andrea Schmidt, head of the Competence Center for Climate and Health, Department for Climate Resilience and One Health at the Austrian National Public Health Institute. Welcome, Andrea. Then I would like to introduce Lina Voltonen, team leader, head of the threat prevention team, preparedness team at the Finnish Institute for Health and Welfare. And then we have Isabel de la Mata, Principal Advisor for Health and Crisis Management at the European Commission, Director General for Health and Food Safety. So, welcome, dear panelists. We will embark immediately on the first question. So this question is for all of you. And the question is, from your perspective, where do you see the One Health approach most useful? We will start with you, Tilly, online, please.
Thank you very much for having me. And well, if I need to pick one sector mainly where it might be the most useful, I would speak about climate change. I think that is really where we need to tackle the most climate change, and also, but part of that is also the natural and animal exploitation. If I may go a little bit more into the detail, long time now, we have always seen these two topics in different sectors. So would it be at the national, at the local or international level, but those are really very closely linked. And I think that is very important to really consider how the climate change, and it was so well explained already in the video, all was said there. So congrats, by the way, for this excellent video. But it is now we agree on saying that the topics are closely linked, that they have an impact of health and wellness. And we know that heat waves, air pollution, wildfires, extreme floods, etc., it was said, they favor the conditions for the mosquitoes, and then they favor, of course, the spillover of pathogens. So we know today that 60% of novel and epidemics, they are coming from zoonoses. So what we need now, and that is the big challenge also I tackle already, is really to implement really in our policies this One Health view, and also to have a more long-term vision regarding the One Health. So when we speak today about impact assessment regarding legislation, we often focus on economic and environment, but we don't look at the One Health approach. But it's really the One Health approach that would allow also having or considering the precautionary principle. And that is what we need to do more. And we need indeed, and the video showed it also very well, concerted efforts to do that. So it is about antimicrobial resistance, of course, but it is not only that. It is more general that in every time we need to consider this One Health approach and the impact coming from the climate change and from the nature and animal exploitation, and then the impact on human health.
Thank you, Tilly. I would then like to turn to Isabel de la Mata. Please.
Yeah, thank you, Ole. I will concentrate in two areas that are AMR and zoonosis. First, for the AMR, that is the top global public health threat, and that is costing 35,000 deaths at the UEA level and more than 1 million deaths at the global level. And if that is not enough, we can say that the economic cost is more than 11 billion euros annually. So it's really an issue, a problem. One of every 5 deaths in children under 5 are also caused by AMR, by infections that previously were treatable. So we really need to think what we are doing bad and what we need to redress. So the fight against antimicrobial resistance has been in the activities of the Commission for more than 20 years. We had the One Health Action Plan against AMR already in 2017. We have the Council recommendation on stepping up EU actions to combat antimicrobial resistance in a One Health approach. And also, this one includes the recommendations to the Member States and to the European Commission in a whole One Health spectrum and a whole One Health approach. the declaration on the United Nations high-level meeting on AMR will be a really very important step for curbing the increasing health risk that is posed by AMR. We hope, at least, that we could agree on concrete action-oriented and global commitment, not just declaration. As all the member states, the European Union member states are members of the United Nations, we understand that the commitments that will be taken there will be also be taken by the member states and will be tried to implement. That we could in that way improve the prevention, the surveillance, the monitoring, the financing, the innovation, the awareness raising, so everything that will be brought. Regarding zoonosis, Pamela already mentioned that one of the COVID-19 things that we have learned is that we need to communicate better. We need to coordinate, to collaborate across sectors, across borders, across discipline, so that currently between 60 and 70% of all emerging communicable diseases are zoonotic, so are jumping from the animals to the human. So it's clear that we need to prevent this in the animals to avoid that these diseases are tackling us and become a problem for us. The Commission has legislation already established on animal health, food hygiene, and since 2022 we have the important regulation on cross-border health threats, and that defines the One Health and provides different measures. And this is brought also with the training, surveillance, interconnected alert system, and also bringing the experience of specialists in several domains. Thank you.
Thank you. And I'll turn to Andrea. Where do you see the One Health approach most useful?
Yeah, so you've already heard so many different topics, from climate change through zoonosis and AMR, and by now you may be thinking, how can we actually bring all of this together under the One Health approach? And I had the same thought when we prepared this session, and I think really One Health can be a magnifying lens for all of us in our work. Myself, I work at the national level, not at the European level, at the Public Health Institute. And often One Health is a bit of a buzzword for many of us. So we hear it quite often. But then when it comes to the nitty-gritty details of how we actually implement that, it becomes a bit more complicated. But I do think that One Health is a magnifying lens to look into the areas that we might otherwise forget. And at the same time, I think One Health often requires a bit of a, if you remember your school time, a word book that we sometimes need. When I started to work on climate change and health, I realized how difficult it is sometimes to speak the same language. And I think when we talk about One Health, this is a crucial issue, because in order to build trust across the sectors, if it is agricultural sector or animal sector, if it is health systems, if it is environment or climate sector, we need to speak the same language. And I think where the One Health approach can be most useful, actually, and also linking it a bit to the pandemic preparedness, is really to think about it as a tool to build resilience for our systems, in my case for health systems in particular. And you may remember the wording, the build back better after the pandemic. And actually, resilience is a word that comes from physics. It would actually mean return to your original state. But the International Panel of Climate Change actually uses it also to talk about transformation. And this is, I think, where the One Health approach comes in. We can no longer have the business as usual. We need to go beyond that. And it becomes a bit more complex when we think about it also and embed it a bit more also within the society and social systems, because humans are embedded in societies. We cannot talk about human health without the social implications. So to make it even more complicated, I would like to add also the social perspective on the One Health approach. And maybe just to give you one short example in this introductory statement, think about heat impacts. I don't need to tell you, heat is killing thousands of people by now every year. We are seeing, unfortunately, new records every summer. And 2024 was again the hottest year in Europe, and probably probably also among the hottest globally. And that obviously has implications for our health systems, for the health workers who suffer from the burden of heat, for mortality. But it also has implications for our food systems, and that's where animal health obviously also comes in. But just to link it to food systems, we see that the European Environmental Agency published the climate risk assessment, where they talk about all of this and also the cascading risks of heat and climate change. And this is also where One Health comes in. So for food systems in Southern Europe, the European Environmental Agency calls for an urgency to act in Southern Europe, for example, because of crop failures and reduced yields. So it's not just about human health, it's also about our food systems. And then to make it worse, it's also about our supply chains. It's about climate-related disruptions to food supply chains. And that is where also the social aspects come in, because then we see volatility of food prices, and that affects, of course, again, low-income households. So you can see that the One Health approach can be an important tool for many, many areas, but we cannot be naive about it. We need to acknowledge also that this is a very complex task, and I look forward also to the next statements.
Thank you, Andrea. And I turn to you, Lina. Where do you see the One Health approach most useful? I think it's on, try speak.
Okay, thank you very much. And I really appreciate the opportunity to be here with you today. One perspective for the One Health approach is the, so to say, fire brigade side, when something actually is happening in the human-animal interface. There is an outbreak of a disease that can pose a threat to human health. And this is, in the response to these outbreaks, we need to have One Health approach and multi-sectoral collaboration. And as was already mentioned by Director Randy Wagner, we had an outbreak of avian influenza on Finnish fur farms last summer. The H5N1 virus spread from wild birds to fur animals, and tens of farms in the area were affected. And this is where the multisectoral work was crucial, especially as this happened during the very deep summer holiday season in July, when Finland is practically closed for business. However, the Finnish Food Authority, who had the main responsibility of the situation, managed to perform very well, engaging multisectoral stakeholders from public health, occupational health, on multiple levels of administration. So we worked together with the animal health and occupational health side to align our communications, the countermeasures, risk assessment, etc. So this was a successful effort. It was a huge effort and a very economically costly effort, and we could have been better prepared together between sectors. Thank you.
Thank you, Lina. So with this example here of the avian influenza situation in Finland, I think we were actually provided with an example of how this intersectoral collaboration could work well. In the next question, I wonder of your view on how a smooth collaboration between the animal, human and environmental sectors can be established. And Andrea, I wonder if you would start.
Yes, I already mentioned before that this is not an easy task. I have a background in economics and social sciences, so I will start from there with the solutions that I will offer. I think one possible way to start is, in fact, something that might sound very boring to you, but it's actually evidence-based frameworks where we have indicators from all these 3 areas that link to quality of life. So to make it a little bit more concrete, in Austria we established 2.5 years ago the Competence Center Climate and Health. And I can tell you that already linking these 2 areas is not an easy task, and it, especially when we talk about measuring the impact that climate change is having on health, on human health, on health systems, this is already quite a long way to go. Now, if we add animal health there, this becomes, of course, even more complex. However, I still think that having the right indicators and the right data frameworks will help us to really make visible where we need to look and what we need ultimately also to do. That's one. But I also said I'm also a social scientist. So the second ingredient I would like to suggest is trust. When we had the experience of the COVID-19 pandemic in Austria, we actually we established something called the Future Operations Board, which ended up being a weekly meeting, online meeting of experts from different fields, including experts on schooling, experts on infectiology, experts from microbiology, but also the economists and people working in public health. And these people often didn't know each other before the pandemic. But then suddenly, on a weekly basis, we had these online meetings and we started discussing the indicators. And then, people from the school sector would add to when the infectiologists were talking about closing the schools. They would mention the young mothers that would have to take care of their children, the quality of life. So it was the first time, I think, where we really understood what the importance of trust is when we talk across sectors and across scientific disciplines. And the same applies also when we talk about One Health approach at the public administration level. Because ultimately, the people who work in the Ministry of Environment or the people who work in the Ministry of Health will need to be convinced that it's important to work together. And that's again where the frameworks come in, the common vision of where we want to go, why One Health is important for us to create a better life for everyone.
Thank you. I will go over to you, Isabel, to ask the same question. How can we ensure the smooth collaboration between the sectors?
I'm going to mention the instrument that already exists. We have created last year, for example, the One Health AMR network that is composed by representatives of the member states in all the sectors, but also for other relevant stakeholders. Also, there is a joint action that is funded by the EU for Health program with more than 50 million that support the implemented measure for integrated surveillance. We need to make sure that all the alert systems are, and they are interconnected. The animal disease information system, the rapid alert system for food and feed, and the early warning response system for humans. There are training activities. There is One Health surveillance program under the EU for Health. There are the meetings of chief veterinary and chief medical officers from the EU member state. And finally, that the advisory committee that was established under the regulation 2022-2371 to declare a public health emergency is finally in place and is going to meet for the first time this week. I also wanted to mention the Climate and Health Observatory that is also financed by us and with a budget of 4 million euros. The last mechanism that I wanted just to mention is the the chief scientific advisors and the scientific advisors mechanism. That is something that was already established some time ago, but DG Sante, we requested a question to them that is about One Health and the cross-sectoral evidence-based governance for One Health in the European Union. We expect the opinion to be delivered in November, so really soon. And what we expect in this opinion is that this group of scientific advisors of the European Union tell us how we can define and determine the field of action, indicators, that is also something really important, how we are going to monitor and to evaluate, and also governance, how we are going to manage that. Thank you.
Thank you very much. So before we move to the part of the session where there will be some replies from you in the audience, I will give the last question here to Tilly. So from what we just heard, Tilly, and considering the challenges of implementing the One Health approach, what challenges do you see from the EU perspective? How could the EU address the climate change challenge to minimize the spread of infectious diseases?
First of all, what is very important for me is to say that we should not only speak about resilience or adaptation. What we need to really focus on is the prevention. So I think that it's, well, in some cases, indeed, it's too late. There we have to adapt. But we must be aware, if we don't focus more on the prevention, climate change is not only a thing that is inconvenient for people, but it's really lethal for a lot of people. People are dying from it. And if I look now what recently also the Lancet journal was publishing, there are not many countries, like now we have Austria on the table, that really have national plans and strategies on climate and health. Now, it was the first time now in the COP28 that we had really, so speaking about climate, which is, so this, as you all know, the summit for tackling the climate change, but it's the first time that we really had a dedicated place also to discuss about public health and climate. So I'm really sure that if we don't phase out also the fossil fuels, the consequences are going to be even more catastrophic than those that we saw with now the coronavirus. So I think right now at the European level, what we have a climate law that is already very good. We have indeed a European Health Union that we are constructing. We have indeed, and it was mentioned already, an antimicrobial resistant unit in DG Sante. But if we don't really now concretely implement the One Health approach in different sectors, it will not be enough to have this. That is clearly what I want to say. And if I look at the future commissioner, it is even being more fragmented now. So some health issues are, of course, the health commissioner who has, and that is a good thing, also now the title official of animal welfare. Some other health issues like the emergencies, the imminent health threat are tackled in another commission. And then we have, of course, the climate issues that are tackled with Commissioner, probably I'm saying that, Ribeira Rodriguez. So we have to make sure that these also work together at the level of the Commission. So if I look now at the mission letters from the Commission, I mean, there is already more presence of the One Health approach, which in the past was mainly tackled when we were speaking, or only tackled, I would even say, if we speak about antimicrobial resistance. Now there is the awareness really there that it is much larger, and it, again, it was very well documented and illustrated in your video that it's much larger than only the AMR tackle. And what we need to do, and also therefore I'm very happy that you made this common video, that is also that these different agencies now concretely work together, that they have, as the director of ECDC very well, Pamela said, this common framework, and that they really work together. So what we need to do, we need to be more, and that is the big challenge, we need to be more consistent and coherent, putting protection of public health really as a priority, because it is also a priority for the citizens. And therefore, we need also to tackle the issues of animal welfare, a more sustainable agriculture, a more healthy environment. And therefore, we need also funding. And that is another big challenge that we have at the European level.
Thank you, Tilly, and thank you also to the panelists for your first round of replies. Now we will turn to you in the audience. I'm sure that among you are also many people who are actually sitting with good replies to some of the questions that we have raised here. The question I would first like to address to you is, what challenges do you see regarding the implementation of the One Health approach? And how do you foresee that these challenges can be overcome? I believe we have 2 microphones in the room. So please raise your hand if you want. They're already there. Oh, yeah, sorry. And please just briefly state your name and where you're from.
Hello, my name is Coria and I'm from France. I'm a student from the MCI in Innsbruck. So I had a question regarding the indicators part. It's interesting and it's useful to have those indicators to have a clear view of what's happening regarding the climate and health indicators, but how do you scale them in between each other when they're all from like a total opposite nature? How do you rate interaction in between those?
I think the idea here was that we would ask a question to you if you wanted to reply to it, but you,
I see it as the challenge.
Yeah, but you can try. Yes, try, please.
We can also talk afterwards if you want. But in principle, I think it needs to. You cannot make it too like. When we work with these indicators, we usually combine it with a participative element where we work, for example, with the regions then to really make them aware, for example, of potential impacts of climate change on their health systems. So we do not create an index or it would make it, I think it would hide again a lot of things underneath. But I can then elaborate a bit more afterwards if you want.
Thank you, Andrea. Maybe I think there was a question on the first out there.
Good morning. Rosa Castro, I work for DSW. It's a global health NGO. Your question, I think, was what challenges for implementation?
Yes, exactly. What are the challenges regarding implementation of the One Health approach and how can they be overcome?
Yeah, okay. I don't have the full answer, the solution, but I think one challenge is that you talk a lot about the One Health being a multi-level cooperation, different levels, different groups and disciplines. And we hear a lot about the EU, but most of these challenges are actually, and Dr. Pamela mentioned it, are global. So how do we make sure that also the One Health approach includes a real global cooperation now and in the future? Thank
you. Yeah, please, here in the front. No.
Yeah. Thank you. Nick Fahey from Rand Europe. I want to offer what might not sound like a help, which is the sordid topic of money. One of the things that a piece of analysis we've just done is a study on the economic burden of AMR in livestock and food production, which is actually just being presented in the margin of the UN General Assembly at the moment because it illustrates just how much that economic burden is relevant for the wider challenge. And I think that economic analysis is part of how we engage wider stakeholders, because ultimately everyone in this room is convinced about the health importance and understands the slow motion pandemic of AMR. And Pamela, you said at the start, we're potentially going to go back a century in medicine. And that's one type of argument, but we all know there's a wider world out there for which our common language is money and the economic potential devastating cost. But the challenge, I think, is being able to do this kind of analysis, because one of the things we found was that when you try and do analysis about the economic burden of AMR, it's very difficult to find the right data and to be able to link the right data sets. And so my request and my recommendation is that we are doing the work that we are doing about improving the data sets and linking the data sets across the different dimensions of One Health, and we do that from a health perspective. But we need to integrate that also with the data that will allow us to make the economic case in the language that the finance ministries and the businesses and the farmers and the funders will also understand. So that would be part of our suggestion.
Thank you very much. And then here.
Yeah, it sounds like that's another chapter that was missing from Mario Draghi's report. But I'm just wondering, I think it's really great that you're all coming together, but of course we already have a precedent for this with the quadripartite agreement between WHO, UNEP, World Animal Health and FAO. And I'm wondering to what extent you've undertaken an analysis of that relationship to see if there are lessons that can be learned, because the reality of it is you're all really busy people, and certainly in the UN system, I'm not going to comment on the EU, there is competition between agencies, and the transaction costs of actually organising meetings and getting together are quite high. So these sort of things, that they're great when everybody comes together, but making it work in a continuing program is more challenging. So I'm just wondering, has anybody actually looked at the quadripartite agreement to see what worked, what didn't work, and what lessons can be learned?
I think I can give a brief reply to that, and also to the remark here from the right side that it's actually a global problem. So at the EU level, we established this cross-agency One Health task force almost at the same time, just before the quadripartite agreement was signed, and we are looking forward to collaborate with the 4 global organizations, of course, in the quadripartite, and learn from what they have already seen. But we are actually almost started at the same time, so let's see. There can be a fruitful exchange of information, I'm sure. And we must take into account that the One Health approach may require a bit of a more tailored approach to the EU countries than it does globally. So, but there's, yes, yes, thank you. Yeah, it's important input. Thank you. Good. I think that now, if there are no more questions in here or anyone who wants to reply to the question about the One Health, no. Tilly, yeah, Tilly, please.
Okay, do you hear me fine? No, I wanted to react also to the question, which is a very, very adequate, very good, on the global approach that we need. And I think what we definitely need, and I think it's a considerable progress that we made there when we speak about due diligence, so that we have to respect, if we import products, but also European companies, that they have to show the due diligence, that they respect also the environment and human rights, etc., also when they are active outside the EU, and that with the products that we import, that they have to prove that they respect the environment, etc., and that we have on the other side also a carbon adjustment measure, so I call it a carbon tax at the border, because we have to tackle the One Health approach globally. And I make the link with the climate change and with the nature exploitation, it's very closely linked to that. And that's why these mirror clauses are very important to be implemented. That was one thing I wanted to say. And then I also wanted to react on the economic question. Of course, we have to consider the economic impacts of AMR and what we need to invest also there. But what we also should consider, especially in the One Health approach, if we don't have this holistic approach that also tackled, as I said, climate change and pollution, etc., what will it cost if we don't react? So we should, of course, see what does it cost, what investment are needed. But on the other hand, we also have in the meantime figures what would happen and what would it cost and the impact on the economy if we don't react now.
Thank you, Tilly. We will now turn, you want to?
Yeah, and I think just also to add to Tilly's comment, it could be even reframed in the sense of what will be the benefit of the action that we are taking. If you think about, healthy and sustainable food systems, it's estimated that that premature deaths from unhealthy diets can be reduced by 30% if we transform our food systems. Of course, it's a long way to go. It's a very strong industry, but still, these are also aspects that I think if we have to become better at showing these benefits in terms of healthy life years, premature deaths, and the related costs that we have, and the benefits of acting.
Thank you, Andrea. So we turn to Vincent and the youngest diners. Maybe you can provide us with a short summary of what you've seen online.
Thanks very much. Just like the audience here, the online audience has also been quite busy sending comments and asking questions. First of all, just on the comment section, just wanted to build on what was said in the audience already, that of course the global component was stressed also by the online audience. And then on the questions, the first question I've filtered out of this was how we can actually also address the individual level. So how can healthy behaviors maybe contribute to fostering or enhancing the One Health approach, and whether there is also the political will to implement this in the national systems, and whether you can maybe draw upon that, what could be measures to ensure that the individual behavior and the political will also go into a direction of further fostering the One Health approach.
Thank you. Would any of you in the panel like to react to this? Yeah, Lina, maybe, please.
Yes, thank you for the question. Regarding the individual level and avoiding behavior that is not benefiting health in general, I would like to come to the example of the avian influenza in Finland. We had difficulties to reach the persons who were actually in the most risk for avian influenza on the fur farms. We worked well with the front organization of the farmers, and they were extremely helpful in communicating to the farmers about protective measures on vaccinations, etc. But somehow we didn't get the message through in the way that we would have wanted to. So our burning question is, how do we sensitize individuals, and how do we reach them through the right community leaders, stakeholders that actually can have an influence on the behavior of persons? And I think that this is also a big question about building trust. Like Andreas said, that we need to have those persons who can influence the people at risk on our side to bring the message through. Thank you.
Thank you very much. Any other reaction, Tilly or anyone else? No? No. Then we go to the last part of the session. And here we will look at the ways to move forward to the One Health implementation. But actually, just before that, you could also consider if there would be any possibility that we could not only try to be better prepared, but even prevent that a new pandemic occurs or reduce the likelihood that it will. So the next question is, how can the different sectors, including the governmental organizations and policymakers and civil society, work together to reduce the likelihood of a new pandemic occurring? And I wonder, Tilly, if you would start.
Yeah, with pleasure, of course. Let me focus on one specific point. It was already mentioned a few times now, and that is the link also with the agriculture and with food. So that is an important part of the One Health approach. And what we definitely need to do is also in the context of prevention is to stop intensive farming and also switching more to a plant-based food. But this is something, and you speak on how considering also the opinions and the needs of the civil society and of the farmers, this is something that came also out of the structured dialogue where the farmers were represented, where civil society was represented. So let me focus a little bit why we need definitely to stop this industrial farming, and that this, we all know it, you all know it, that this plays an important role in facilitating the spread of new infectious diseases. Finland was now speaking about fur farms. We have a European citizen initiative. People don't want any fur farms in Europe. So that's something that is bad. It's cruel for the animals. It's a high risk of spreading diseases. You heard it. So it is intensive farming, but not only regarding the fur farms where there is a lot of cruelty also linked for the animals. In general, intensive farming where we have huge numbers of animal on close quarters. Of course, this increases the chances of pathogen spreading rapidly within a population of animals and then jumping from animals to humans, especially as we transport also the animals throughout Europe and even outside. On the other hand, by cutting forest and habitats for agriculture expansion and also for the feed for this intensive farming, where we are in direct contact then with the wildlife also, again, the transmission from animals to humans of viruses and bacteria is increased. So we really foster, by these practices, cross-species transmission. And then on the other hand, what we also have to consider, speaking about animal welfare and animal health, which has a direct impact on our health, of course, due to the stress that animals suffer from, the lack of mobility, their immune system is strongly weakened. So that's also why we need to really do something against this intensive farming and go more to organic farming, and also fostering biodiversity and animal welfare, and also reducing the chemical impact. So what I want to say, we need a healthier environment, both for animals and for humans, and like that also reducing the likelihood of disease emergencies and emergent to court and spreading. So that's why it is so important also that we come out of this silo thinking and that we need to tackle policies and legislation together. And I think I was very positive surprised of the conclusion of this structured dialogue where we had different stakeholders around the table talking to each other, building trust. We mentioned it so often today, that is very important. And let me make just a very small remark, something that we have to be aware of. If we are now separating the health issue from the making a special health committee, which has positive aspects. I see that, giving more visibility to health. But if we now fragment it from the Committee of Environment, there is, of course, a risk that we weaken even this One Health approach. So that's something we need to be aware of. I'm speaking now from the perspective of the European Parliament. Having a Sun committee has some advantages, but there's a big risk that the aspect of the One Health is a little bit weakened there. I'm speaking also as I'm the first vice chair of this health committee. So there are positive aspects, but I see also the risk of a more fragmented approach there. Thank you.
Thank you. I would then like to turn to Isabel. Would you have a response to this question as well?
Yeah, thank you. I already mentioned before the One Health AMR network where the member states participate and also relevant stakeholders. But I think that we need to mention, already Martin did, at the international level, the AMR multi-stakeholder partnership platform with the quadripartite, and where the Commission continued to be a strong force. There is a new co-funded One Health AMR partnership. Is under the Horizon. The call ended yesterday after being open since April. So we'll see which have been the application. And one of the objectives says literally societal engagement by bringing science to society, creating awareness of AMR challenges, value creation, support the well-being of citizens and sustainability of the environment. So fits perfectly on what we are discussing here. And one thing that was mentioned before individually, there are still a lot of European citizens that or are unaware, or they know, but they have not embedded on themselves the misuse of antibiotics. And so I think that we need to continue with the information campaigns, but not just campaigns. That something is something passive, doing more active awareness, and also with the health professionals, but also take into account the things that could make the citizens to take, even if in a bad way, but antibiotics. I mean, if you have an infection, you request a consultation with your GP, and the waiting list is 5-7 days. Is a way to promote that the individuals, but warn or bad advice by someone began to take antibiotics, and that could be solved with shorter times to go to the GPs or to go to the dentist. That is also a classical example. So continue the awareness with citizens and with the professionals.
Thank you. Short remark from you, Andrea.
Yeah, just a short remark on your question. How can we increase pandemic preparedness? I think that sometimes we make the mistake of thinking only about acute events, such as pandemics, and kind of as preparedness as reacting to an acute shock. And the comment I wanted to make is that I think that we need to shift our thinking a little bit towards resilience as a continuous task, and preparedness also as a continuous task, because we are facing multiple shocks, and our health system is already under pressure. Climate change is increasing this pressure. If we have other shocks, this will increase the pressure. And the vulnerability of the state that we are in when such a shock happens is crucial. And so I think that this preparedness needs to be a continuous exercise, and it includes, for example, also the working conditions of the health and care workforce. That is an important indicator, that we cannot limit ourselves to talking about it once a shock happens, but actually we need to be talking about it constantly and think about how we can prepare our workforce. That was just a comment I wanted to make.
Thank you. Thank you very much. Thank you very much. We're moving towards the last question of the session. And this is about how we now, in the implementation phase, how can we sensitize the stakeholders, the different stakeholders, to commit to One Health, both the industries, NGOs, all over. How do we get this buy-in of the stakeholders to commit to One Health? And here I would like to start with you, Lena.
Thank you. As I already mentioned, we with the avian influenza outbreak situation, we had and still have difficulties reaching the persons who would be likely to be case one if any human-to-human transmissible virus would emerge from the fur farms in Finland, and that the burning question is how to reach these people, and to also understand that the case one person could be a very different kind of person if the pathogen or the process of emergence was different than pandemic influenza on a fur farm. So we need scenario-based work between sectors to identify these groups. But as I said, it might be not possible to clearly identify a clear stakeholder that could reach these groups. And for this issue, I think that we could greatly benefit from research in social sciences. In Finland, we hope to be able to start a study on fur farmers and their attitudes. I know that there has been already before the avian influenza incident, before COVID-19, in this area where 95% of the fur farms are in Finland, there is more mistrust to authorities than other parts of Finland. There is vaccine hesitancy. Helsinki is very far from these areas, and any guidelines or advice given from the capital are maybe mistrusted. So how can we reach these people, and how we can build trust and to study this through social sciences? That would be really important.
Thank you, Lena. And Andrea, how would you see the stakeholders sensitized?
Yeah, I think we've been talking a lot, but I think in the end it's all about the action. And I think that once we start acting, people will also understand the opportunities that the One Health approach actually brings with it. In Austria, we and in also in the Netherlands, in France, in Germany, they've already moved to building. Creating healthy and sustainable food-based dietary guidelines. What does that mean? It means that in our case, the food-based dietary guidelines, so the food pyramid that you probably all remember again from your school time, where you have a lot of milk and a lot of meat. That has been revised already in a number of countries, including Austria. In our case, we basically the recalculation of the nutritional components was done under the consideration of land use and CO2 emissions. So that means that the new food-based dietary guidelines include less meat and less milk, and it's I think a way of actually showing how you can act under the One Health approach, and after all, we know that the food system is responsible for about a third of the greenhouse gas emissions globally, and with a vegetarian diet we can reduce this by about 20%, and with a vegan diet by 80%. So there is a huge potential in transforming our food systems, and that of course has then also the implications for the farming practices, for the way the supply chains are organized, for making them more resilient, possibly against pandemic, etc. So yeah, I think action is one way to sensitize and to bring everyone on board.
Thank you. And I turn to you, Isabel. How would you see the stakeholders sensitized?
Communication, awareness, listening to the needs, to the concern that everybody has, but also to the experience that they can bring to this discussion, not just from the scientific point of view or from the human health point of view, but listening to everybody. Continuous exchange, regular exchange with all the different stakeholders. And then also we need to measure. If we don't have indicators, measurable indicators and objectives, we cannot see where we are going. We can say whatever we want, but we cannot convince anyone. And finally, the economic case. If saying that 35,000 people died, that 1.3 million people died at global level, that it's better not to have a disease, so prevention that to cure, maybe the economic case will make the issue. Maybe saying that you will save 11 billion euros could make the case, even if, I mean, we have been saying that prevention is cheaper than treatment for many years, and with medium success, I would say, but insist on that. And bringing everybody on board. Everybody's experience is important.
Thank you. So, Tilly, I turn to you as the last responder here in this session. How would you see, how is the best way to sensitize and engage the policymakers and the EU? Thank you.
let me make, if I may, 3 remarks here on that question. First of all, I think the most important is to make the right questioning. And I found it very interesting today on the panel that we have the, and don't take it personally, please, we have the Austrian approach. For me, they are asking the right questions in order to really achieve a paradigm change. And then we have more the Finland approach, where we focus only on pathogen control and how we can vaccinate people, instead of asking the right question in order to have a paradigm shift. Because to tackle the One Health, ask also for paradigm shift in our consumption. Would it be regarding food? Would it be also regarding what we are wearing, the clothes that we have? We don't need any fur anymore today. So I'm asking, and the solution would be easy there if we had a ban in Europe on fur farms and the import of fur. But so it's about asking the right questions. That's the first remark I would like to make. Secondly, tackling the One Health approach needs certainly an economic approach, needs a social approach, but I'm a psychologist from where I'm coming from. It has also a lot of psychologistic aspects. It's also about feelings, it's about motivation, it's about commitment. And I think it's very important we take the people and also the politicians where they are with their fears, with their demands, with their all day, every day questions that they have. And how can we make politicians commit? But if we tackle this issue of One Health, and I take it in a very simple way now, it's something that is important for the voters also. Healthy food, clean water, air pollution, access to healthcare, those are things that matters to the people, that are really concerning them in their daily life. So we should not neglect the aspect of the feelings, of the deeply motivation in order to make the people move, and that in order to achieve kind of paradigm shift. And then a third remark I would like to make, I think we should also use the One Health concept as a tool of a screening tool, a tool of assessment. In every legislation that we make, we spoke about these indicators. I think that would be very important, that in every legislation that we make, we would also consider the impact on the One Health concept, and looking at what does it really mean in the concrete, also daily life of the people. Thank you very much. And thank you again for having me.
Thank you, Tilly, and also thank you to the other panelists. Thank you for coming, and thank you also for the interaction with the audience. I'm quickly looking to Pamela if you want to say something last, or no, that's good. So in this session here, I think we covered a lot of ground. I think entering the pandemic question with the idea, oh, this is something that we shuffle over to the preparedness and response people, and they will set up a system and they will take care of it. But I think what we heard today is that there are several layers of solutions behind the whole preparedness issue. I think we were reminded that we need to sensitize we need to first analyze the problem, find the solutions to how we increase this ability to conduct the cross-sectoral collaboration, and then we need to sell this to not only to our governments, but also to the stakeholders that are actually involved in the field in those areas. There are even we also visited here the EU level and the global level of the One Health problem. I think we can look at it in the way that there is a need for immediate action to improve our preparedness for meeting the next pandemic. So putting the pieces right so that we are well prepared for the next pandemic in terms of the organizational ability. Secondly, at the same time, we need to work at a larger scale on those issues that can help to prevent that the next pandemic occurs and can help us to minimize the risks of a new pandemic. Thank you very much for today, and I wish you a continued good conference. Thank you.